questions?
I have no questions. I'm writing down.
He's my shy child. Ah, okay.
Oh my God.
See, you're trying to learn.
How'd it go down there?
Good.
It went okay, except for, security decided to manhandle Justin Bernard.
It's the Mark's birthday summer.
One of the houses on the floor and screaming about it. And then my Did you see that? They backed up against the wall.
Maybe there needs to be your picture.
Somebody else said. Yeah.
Because the back trucks are going to get close to the tank, and they're not getting straight off, they're coming right up.
Yeah, they wouldn't get straight up. They're not straight.
I thought that was the end.
No. The control there where they
No,
the water.
you're hooking that up. Like I said, there's 20 or 30 of them every hour that's coming down.
Yeah.
And they're coming at high rates of speed.
It's just water. It's just water.
No, it's that I just talked to, nothing like this, I just talked to them about it, used to be assistant center, when I took this old lady down there. Because the mayor said you're not supposed to be running any of those trucks on the street. We took down, there was Blue Oak, there was EnviroServe, Night, today it was all the companies that said Night. And they're coming down Market Street and then turning on James Street and coming out Tag. I was helping the people that are living right on the corner of Martin and Tag, or Martin and James. And I'm telling you, but they're telling me they're sitting there nonstop, flying, nonstop.
I'll check their off space.
Did you see the
What grade are you in?
Does Rick know?
He's always in school. It's important.
Like I said, these trucks, I was
You know, I'm a little active, what did I have to learn all this?
It's a little scary. Everybody's using that little back road now.
Some more people.
Yeah, because I heard that Tiger Street shut down just for it.
Yeah, so I didn't figure out why.
I think it would be better to
Part of the issue.
For me, the stress level for long.
So when did mom start puking? During COVID?
But this has been going on. Yeah, I got pictures way back from the beginning.
So have you ever gone up?
I brought it up to the mayor several times. I've actually, they was, got all the feet on the street.
Yeah, I've got a
I feel like usually when we do questions, we try to use the mics, but they're not for questions. Okay.
If I was at the school,
The year's going out. 45 miles an hour.
I don't have kids, so I've never homeschooled anybody.
Tell her about some of the labs that we do mention.
Trying to find her Airbnb right now. It'll take me 2 cats. After me, and then in the
Like science labs,
they've
like
been in their
how
homes.
personal.
They have no transportation. She is severely confused with blind in one eye, and her mom's 82. Her mom almost died 2 days after they lifted the evacuation. They're sick every single day, and she starts calling, saying, Jesus, thank you for your brothers, and I was glad to see you.
Well, I told her if she gave, they bought this big air conditioner for her. Just 'cause
Her mom can't breathe upstairs. She is the
So I went over and listened to her. So me and her son put this thing in. Got it all hooked up. I gotta plug it in here. It's 220. I was like, what is that?
You know, it's funny, we talked, because last Sunday, I was mowing the yard, and I found this little tree frog. And I took it to my boyfriend, and he patched it. And he scored it, but they were, I was gonna ask, so I put it back, and pulled it over, that, and finished mowing, and I went running for it. So after I was done mowing, I went back and just go there,
Mark's gonna be in a lawsuit, well, I guess we're gonna.
But when I was in seventh grade, I remember that side of Mark, and I frog. So have you dissected a frog? Yes. Yes?
Frogs that we have organized. So there's actually 20.
So then I want to or they did charge.
I got him some nice glossy.
I didn't hear it. I was reading it. What'd you say,
My name's Tell them about the frog that I found. I remember dissecting that when I was I thought it was kind of gross at his age.
I guess I didn't see I got this
I thought that, no, I thought that was the bone. I really want to. Yes, because
It has today's date on it. Maybe it This one does. Oh, wait, maybe she was talking about that.
Hearings on Thursday, Friday.
No, the news one.
Because tomorrow they're
She did say it could come out today, but
You can have her tell her how it went.
All right. Hello. It's on? Hello? Hello? Hey, everyone. We're going to go ahead and get started. Thank you all for coming tonight to part 3 of our public health informational session. This one is public health resources. So we have different local agencies here that are going to talk to you about resources they provide. I'm Phil Gurley. I'm a community involvement coordinator. And then we'll have time afterwards for Q&A. And as in previous sessions, we'll have a mic to pass around for Q&A. And again, the mic is just to help for our recording. So when they're available online and you share these with family, friends, folks can see and hear everything. So, yeah. All right, so I'm going to pass it to Wes first to kick things off.
All right, thank you, Phil. I wanted to say thanks to Phil and for Mark for putting these sessions together. I think it's great. Gives everybody an opportunity to come together and get all your questions answered at one time and bring some subject matter to the floor that I think is important to a lot of our residents in our community. So appreciate you being here. I'm Wes Vins. I'm from the County Health District, and so probably our primary role at this point in the response is the groundwater sampling that we're doing at the private residential homes. And so that continues. We had 2 teams in the field today. They had, I think, 10 wells scheduled for today. We accomplished 8, 2 canceled. There have been some folks that we've sampled multiple times, so we're into the 4th round of sampling in some cases. Other places, only the 2nd round of sampling. So we continue the sampling. And I wanted to make sure everybody here knew, so you can tell your neighbors and your family that we continue that sampling program. And if you want to get on the list to get sampled, you can call the phone number. It's 330-849-3919, and that'll get you on the list to be sampled. That's correct. Yeah. So there's really 4 priority areas or target areas at this point. There is a 5th area, which is the outer area outside of those priority areas that we started with. The area 5, people are still welcome to call in if you're in area 5, but at this point we're only sampling areas 1 through 4. Recently there was an expansion of that area. I think Laura might have talked about that. Laura Faust from our office gave a really nice presentation maybe a month ago, I think, on the groundwater sampling program. But if you have any questions about that, we have it on our website. You can go to our Columbiana-health.org website. You can get a lot of the information there. Also, the phone number, in case you forget for some reason. The phone number to get scheduled for the sampling is also on that site. An important piece to this, Norfolk Southern also collects samples, as does the County Health District. They do go to different laboratories. So our teams collect our samples, their team through their consultant collect their samples, and then they're sent to 2 completely different laboratories. Our laboratory results are posted on our website, so you can actually go and look at water samples that we've been collecting. So that's probably the summary of it. There'll be questions at the end. Is that right, Phil? Yeah, okay. So I'll turn it over to Dr. Gretchen Nickel. Dr. Nickel.
Thank you. I'm Gretchen Nickel. I am the medical director for River Valley Physicians, which is the group that is working out of the clinic here, which was the clinic that evolved from the original clinic that was in the church. I'm also the chief medical officer for East Liverpool City Hospital, so we've been working closely with the health department in that regard. So just to give you a summary of what we're doing in our clinic that's actually right here across the street, as I said, it evolved from the original church clinic that we had, which at that time we recognized needed more. We needed to have lab availability. We needed to be able to treat certain patients. And in that capacity that we were there, we were getting survey results. We were helping to facilitate patients seeing their doctor, and by the doctor calling their doctor to say, here's what we're finding. But we did see the need to have a permanent clinic here. So we did open the clinic that's located across the street. That clinic is a full-service primary care office. So it's not meant just for the purposes of patients seeking care regarding the train derailment, but it certainly is there for anybody seeking services from the train derailment. We're able to do the screenings that have been recommended by the Ohio Department of Health that they obtained through working with their toxicologist. We are also able to get that lab work right there in the clinic. We've been able to also provide services to the first responders in the same way to do surveillance and any lab work that they would need. And again, we are a full-service primary care office, so anybody that is looking to establish primary care can get that there as well. We initially started the clinic on a Monday through Thursday basis and realized that we had a need to be there on Friday as well. So the office is now open Monday through Friday. We have not branched into weekends at this point, but if the need arises, we could consider doing that also. We are currently accepting walk-ins as well. We've been able to accommodate the walk-ins every time that they've needed to see somebody. The only downfall that I can say is, unfortunately, that was a clinic that was put together very quickly, and we needed providers very quickly. And so sometimes we've not had the full providers that we've needed. So we've had to have somewhat lesser hours on occasion, but that seems to be resolved. So if you have heard anything of that nature, it seems to be resolved at this point, and our goal is to be open Monday through Friday and allow walk-ins as well. Really the summary for the clinic, and we'll take questions at the end. Okay, all right, thank you.
Thanks, Gretchen. My name is Tom Andrews, and I'm the CEO for the Community Action Agency of Columbiana County. We provide a multitude of services for Columbiana County, but I'm here tonight to talk about our federally qualified health centers. In East Palestine right now, we have 2 Head Start centers in the elementary school and service those kids and families. What I'm here to talk about is we were, just like Gretchen and the East Liverpool Hospital, we are part of that health assessment clinic. And I don't know if any of you saw our mobile unit. We just got the mobile unit just before the train disaster, and our plan was to go out into the community to offer services. We also offer primary care, behavioral health, dental services, and we have a pharmacy, a 340B, which is reduced cost for people that have medication. A federally qualified health center takes Medicaid, Medicare, takes most private insurances, and if you don't have insurance, we look at your family income and then offer a sliding fee scale. So we can help people that can't afford regular health care. We're here to serve the underserved in the community. Right now we have 4 other offices in Columbiana County. The closest to East Palestine is in Lisbon or East Liverpool. We serve about 430 patients from East Palestine. So we've brought the mobile unit here to offer primary care and behavioral health, and we're set up at the church, First Church of Christ on Martin Street. On Mondays is primary care, and on Wednesdays is behavioral health. I have bags in the back with information and a flyer with telephone numbers you can call if you choose to see us. We're trying to build a patient basis so we can help people that don't have good health care, don't have a primary care. So we're here as a way of helping in the community. Our agency's been around since 1965. Some of you know about our energy assistance program and others, but I'm not here to talk about that. So I guess we would like to see more patients so that we can have a regular patient basis. So I guess we'll wait till the end for who's next. Marcy, you're next.
Thank you. Hi, I'm Marcy Patton. I'm the director of the Columbiana County Mental Health and Recovery Services Board. The board is the public entity that oversees behavioral health services in the county. We don't provide direct services, but we work with all the different agencies and different projects. So we've been involved since the train derailment, first at the health clinic, having individuals there and available. And then since then, doing a number of things. We've been the recipient through the state of Ohio of a federal grant that's helping to provide behavioral health services. We're waiting on an extension of that that'll go for another year, and all kinds of additional things will be included in that second grant. With the first grant, we've had some support groups that have been going on. One of our counselors for one of those support groups is here with us tonight, and we've had those going on. Those are just finishing up, but we'll be having additional support groups and things down the road. We also have been doing some outreach events, just trying to let people know what mental health resources and behavioral health resources are available. There's been a number of flyers, and there's some up here on the table that talk about the various behavioral health resources. One of the things that I think has been really exciting, not because of the situation, but we have been able through both the federal grant and through the railroad to have a number of services available for free for individuals. So if you have copays, if you have deductibles for behavioral health services, those are covered. Insight Counseling and Wellness has an arrangement with the railroad for that. The Counseling Center, Family Recovery Center, Community Action Agency, we have arrangements through our federal grant. So those costs are covered. So people don't have to have that as a barrier for their services. We're going to be doing a lot of things in the future. This is Diana Fabry. I'm going to let Diana say hi. She is our East Palestine Resiliency Project Director. And through the East Palestine Resiliency Project, we actually have a resiliency center that we're going to be opening. There'll be some additional stress-related things, chair massages, counseling, some creative arts kinds of things, just a lot of different things to help people, trauma-focused yoga, anything that we can do to help alleviate the stress and some of the concerns that people have, because we know that this has been a really difficult time for people, and feeling stress and anxiety and worry is natural. It's a normal thing, and you may have that for an extended period of time, and it's okay to feel those things, and it's also okay to talk to somebody about those problems so you can get some help and some relief from those things. So I'll let Diana say hi.
Hello, I am Diana Fabry. I am the director of the project that Marcy's discussing with all of you, which is the East Palestine Resiliency Project. I assume that most of you have probably not heard of it yet, because we really haven't been out in the community too much, but I am doing a lot of outreach, and I am going around from one business to another, just seeing if anybody, could benefit from support groups. So I should be hopefully meeting a lot of you and getting to know everybody, and hoping to provide you all with some support. So I think one thing that Marcy didn't mention, but we are hopefully going to have some events at the garden downtown that Threshold has been using. So we are going to hopefully, have some support groups there at that location, maybe add some additional gardens so that the community can use those, and have some events. So yeah, we have a lot in store, but we are, just getting started. So it's good to meet all of you, and I think that's about it.
All right, thank you again, and please feel free to reach out if there's any needs or things you see, because one of the things with our grants is we're developing this based on what you want and what you need, not what we think is needed, but what the community feels would be helpful to them. So please make sure that you let us know those things.
Good evening. My name is actually Susie Kuzer. I'm the Chief Operating Officer for Mahoning Columbiana Training Association, and we operate the Ohio Means Job Centers in both Mahoning and Columbiana counties. This is Cindy Bresnahan. She's our business service representative as well. So just to kind of let you know, we handle everything that has to do with employment. So if you were displaced or need to find another job, maybe upskill some trainings, we can help pay for school and that type of thing. Cindy works directly with businesses, and she has been out a good bit, and I'll let her talk about some of the things where she's gone and talked to businesses. Our Ohio Means Jobs manager for Columbiana County has actually been setting up at the library twice a month. The next couple weeks he's on vacation, but if anyone was wanting to go in there, we had put the dates on the website, and we're able to share with you when we are there. So there's information in the back, and then we also have services for youth as well, in school and out of school. And if there's any individuals who, even youth-wise, that are looking, stuff with school, if they need, we can help set up services for tutoring and for mentoring and for counseling and all of that stuff, and they kind of have just an extra support team to help them along the way if there's any needs there as well. So, and then I'll pass this off to Cindy about business.
Okay, so like Susie said, I work with employers, so I've been talking to some of the employers, and there's a lot of resources that are in place already that can maybe help employers, certain grants, and maybe just different ways of doing business. So what we do is we do a short interview with the businesses and then maybe connect them to some resources that aren't necessarily, that we've always done, and also help them with their hiring needs. So maybe they've lost some employees due to the derailment. We can also post jobs. So if you know any businesses that are, maybe can help or benefit from our services, send them our way, and I have my card in the back. Okay.
All right, thank you, everyone. So now we'll go into Q&A, and we will have a mic going around as well. Yes, Jamie.
I wrote mine down. Do they do vinyl chloride testing at the clinic or on the van? And if so, do they do it for children? And also, are doctors now allowed to give chemical diagnoses, or are they still under the CDC's recommendation that you don't give chemical diagnoses?
I was never given a recommendation not to give a chemical diagnosis, so I'm not sure what that question means. Actually, our diagnosis is chemical exposure for the screening that we do. We are not checking for vinyl chloride as part of our regular screening. We can check for vinyl chloride, it's just not the part that's recommended, and that is covered through the work with the Ohio Department of Ohio Department of Health. So we can order a vinyl chloride test, and East Liverpool City Hospital can run that. It just wouldn't be part of the free service that's provided for our patients that were exposed to the derailment.
And I know I was at actually East Liverpool Hospital the week after the derailment, and I have a copy, I'll find it somewhere, of that memo that said not to give chemical diagnosis because you can't actually test for chemicals. And that
Never.
was the diagnosis that they gave me, was an upper respiratory infection. It didn't say anything about the exposure to chemicals.
I don't see, I never saw such a memo, and I certainly was never told not to use a chemical exposure.
The CDC gave you guys a memo too, not to test for vinyl chloride, if the doctors were saying it, CDC said they didn't. I'm sorry. And then, are there any services for children through the behavioral health? And that was one question. And are there any events being held outside of town for the behavioral health?
The answer to both of those will actually be yes. One of the things that we're working on with the Resiliency Center is it will actually be located outside of the city limits, close but outside. And as soon as we have all the details worked out over the next couple of weeks, that information will be shared. We will be doing a number of events throughout the community. The kids will be involved in. Ohio State University will be working with us as part of that and doing some events throughout the summer and throughout the next year. There's also, counseling available in the schools. I know that the schools have made arrangements for counseling. I think that's through Insight. But again, if you're going to any of the other agencies, those services will be available, and the counseling will be open, and some of the groups and the events and things will definitely involve youth and children. So,
Thank you. I think Unity Council needs mental health right now. Just one last question, I promise I'll shut up. Are any of the medical doctors working with the independent doctors that are coming in to kind of information share or map symptoms like Dr. Galam, Dr. Haynes? Are you guys hooked up with them at all?
Nobody has reached out to us regarding that, but they would probably be reaching out to the Ohio Department of Health for that
Okay.
if they had questions. There was a webinar that got everybody together that wanted to be together throughout the counties of people who would be expected to be treating patients from here that took place while the temporary clinic was still open, to get that information out to the doctors so they knew what recommendations were. But as far as any other doctors reaching out to ODH, I'm not sure.
Is that something you guys would do, is work together? I'm not sure how that works in different professions.
Oh, sure. If I'm understanding you correctly, if you wanted to come to that clinic and I was the doctor there and you just wanted to have the screening, that's recommended, but you have a primary care doctor.
No, I'm saying, like, Dr. Galam is from California, Dr. Haynes is from the University of Kentucky, and they're coming in to do health tracking and health symptoms. And I know one of the things that was said to me is that people don't go to the clinic, then we don't know they're sick. So if, people choose to go to one of these independent doctors like Dr. Galam or Dr. Haynes, is that something that you guys would be like information sharing? Like maybe
Oh,
creating a-
certainly. Any data that we're collecting as far as the train derailment is concerned is there and we would share that information whenever it was appropriate.
Thank you, I appreciate it.
Gretchen answered most of your questions, but we would do the same testing if it was required. And we would work in collaboration with all of the physicians and share information once it's signed off by the patient.
Right.
So we would have the same services.
Thank you.
Okay, I have a lot here. So, you, I don't remember who's who, but, they were saying that there were, support groups that were going on, and I was wondering how that information got out to the community, because I, during my time of total devastation and needing some counseling, I didn't hear anything about that. I don't know if are you doing it on, how do we find out? How does the community find out?
I think that is one of the biggest challenges that I've found is there's so many things happening and it's really hard to get all the information to all the right people. We shared that information through a variety of things. We did share it on social media, on Facebook accounts, on some of the East Palestine websites. We handed out tons and tons of flyers at the East Palestine Street Fair. We had a booth set up. Diana was there, and some of our other outreach people. We handed it out there. What all else did we do, guys? We had it. The one group was held here in this building, and there was information here at the way station. The other one was held at the library, and so there was information at the library that was put out. I'm sure we missed getting all the information out, but that is something, again, we could use your input on what's the best way to get information.
EPA stuff, we get them every other week, or every other day.
I mean, things can be sent to
I
the,
think the city should really be
Have
having
a
umbrella
webpage.
to guide us in the right direction. They should have all the information in one central location.
And they,
This week, there are 5 different, there's a meeting every single day.
yeah, there, and that is one of the
It
things.
all needs to be in one place.
We would agree, that's been one of the hardest things, I think, one of the hardest challenges is to get information to everybody. And I know that the city manager, the council were aware of some of these things too, but just to try to find one place to get it all is
They
really,
may need a push from somebody other than us residents that this is necessary,
yeah.
because we are fumbling.
And anything, again, if, any of us can help, I know all of us would be willing and would love to get our information out there to everybody.
another question I had is you said that you are doing lab work. Can you give me an example of some of the lab work that you're doing?
Sure. The lab work that was recommended from the toxicologist for anybody exposed is what's called a complete blood count, which is your white count, your red count, your platelet count, the things that clot your blood, and then what's called a comprehensive metabolic panel. So that's going to include all of your electrolytes and your kidney numbers and your liver numbers. And to have those checked, and the recommendation is check them every 6 months for the first year, and then every year after that. And it's based on the patient too. So if a patient comes in and says, I'm having certain symptoms, then there might need to be other testing done.
Thank you very much. Sorry.
I do have one more question. Is the Ohio Department of Health compiling this data from all the different, from Mercy Health, et cetera, from Cleveland Clinic? Do we have anybody in charge of the data of what's going on health-wise in the city?
I can't answer that question for ODH. I don't know their information.
What about Columbiana County Health Department?
Yeah, so we're not going to be the sink for that information. It's not going to all come to us directly. Ohio Department of Health, probably their Bureau of Infectious Disease or Epidemiology is probably the place that would happen. It may also be happening with CDC, as we talked about bringing all that before. And I think some of the speakers last week or 2 weeks ago, Mark, I think they talked a little bit about that.
They are collecting data and they are going to the different areas and the different hospitals. I just can't speak to what they're doing with it, how they're doing it,
If
and
there's a
where they're at.
centralized location so they can study it?
Yeah, and the representative from ODH that was there at one of the previous meetings did discuss how they were getting that information from the area hospitals on a regular basis.
And we do need to be working with Pennsylvania when it comes to that, because they're here.
Right, and there is that collaboration.
Yeah, we've seen it on the calls and some of the meetings that we've had, the connection between Pennsylvania Department of Health and the Ohio Department of Health. The epidemiologists know each other very well. I think Kristen Dickerson was here last week, and there were 3 folks here from Pennsylvania. And so, yeah, they're very familiar with one another. They work together all the time on other illnesses and diseases, so.
So I guess this, is it working? Yeah. This is for Wes, Health Department, I guess.
Yes.
So we had our well water tested the first time, but it's been a long time. Are we automatically on that revolving list? Because when they came out, I asked the Health Department representative, and she said she was from another health department, so she didn't know how to answer that question.
Yeah, that's a great question. I would have you call our office and talk with Laura. She administers that program for us.
Okay, so-
If you've been sampled once, typically they're going to come back to your
Because
property.
we're in zone of concern too, so I was
You're in the area
curious
too.
why it didn't, so we have to keep the ball rolling, so every time you come out for a test, we should call to
No.
get on the list again, or?
Typically, they would call you back because we're on a cadence, so we're going to come out every 60 days
Okay.
based on the current plan, so it's going to be a 60-day rotation. Depending on features, but they should have contacted you. The second round of sampling and the third round, typically they would contact you. It's not the responsibility of the property owner to contact the agency to do that work.
Okay,
Yeah, and they do it in tandem with, like I said, the Norfolk Southern contractor.
right.
So there's two. I would have you call our office directly, and that way they can look
Is
that
that
up
the number you
specifically.
gave before?
That would be the scheduling number, but if you called our office direct, 330-424-0272, that might be a little faster path for you.
Okay, thank you.
My first question is, who do we go about, about public health care complaints? We was sent to a couple different places, and we have not got the correct answer for that.
It depends on the type of complaint that you have. So if it's a public health nuisance, that would come to my
Or
office,
more or
at least
less
in
health
Columbiana County.
concern.
Health concern, again, it's going to depend on what your specific concern is about your health. You can start with our office. Typically, the best thing is to go to our website, fill out the complaint form, then what'll happen is our folks then will review it and make the referral to the appropriate agency.
Okay, I've been a sponsor for 10 years on addiction. I was wondering, with the relapse of some of the people that I came across from this derailment, alcoholism, smoking cigarettes, drugs and alcohol, where can we reach out for that kind of treatment and help?
Yeah, that's a great question. I don't have any statistics on that, but we do believe and know that, individuals who have been through this, many of them have struggled with relapse and with difficulties, with their, whatever their addiction happens to be. So the best thing to do would be to call one of the agencies that treats substance abuse. That would include Community Action Agency, the Counseling Center, Family Recovery Center. Again, all of those agencies have services that can be covered through the grant, so if there's financial concerns, those can be taken care of. Hopefully, when the Resiliency Center is started up, we will also have some space for AA meetings or NA meetings or other kind of meetings in the community too. That's one of our goals, is to have some of those things available for folks. And you could always call our office and we would refer you, to someplace. All of those agencies and things are listed on this one handout here. There's a couple that actually they're all listed on.
Thank you, ma'am, I appreciate it.
Like to add to that too, that remember your primary care provider is an excellent resource too to get you to those places that can help you. So if you're not sure, your primary care doctor should definitely be able to do that. East Liverpool City Hospital does also have a new vision program, which is drug and alcohol medical stabilization. So over a 3 to 5 day period, anybody who is suffering from a relapse that needs to come into the hospital to have more of a controlled withdrawal, we can offer that as well.
But nobody that is in active addiction is going to do that.
No, this would be for people that want with.
You need, listen, I sit back here and if I'm not the other one that sees this, somebody has dropped the ball. There needs to be a uniform person that's doing everything, because people in East Palestine and surrounding areas are sick. I don't care about them.
And we're happy to
So-
be that person for you at that clinic that's right across the street.
Okay, but there should be some collaboration in people studying what's going on. I heard the CDC went door to door asking about health complaints. Well, guess what? They went down Taggart Street, never came down my street and asked us what's going on. I'm very sick. And luckily, I do have insurance, and I'm smart enough to find the resources out myself. I shouldn't say smart enough, but a lot of people that are homebound or don't have Facebook or have mental health issues, they have no clue. I think somebody needs to get like a one-person thing and start.
Well, that is one of the goals of that clinic being there, was to be a center spot, to work with ODH to get you all the resources that you need. The resources may not all be in that one building. but the people in that building are able to direct you to mental health and to specialists and to whatever the case may be. So
See, we was gonna start trying to canvas as community members to go to some of these elderly and stuff.
Sure.
And RVO is a nonprofit, and the city wanted to charge them $400 per person to do it because of the vending thing that they did, the city ordinance. I mean, this is what we're fighting here, and we're trying our damnedest to figure this out, and we're not getting no, we're not getting no help, of course, from the city. They're worried about new parks and stuff like that. That's all fine and good. But there are some people out there, and we haven't found the pathway to the illness yet, but there are people out there that's sick. She has sores that she went and had biopsies done. She had CAT scans done because of this, or neurologist. She has MG. You know, she's getting all these testing done, and then after looking at these sores, they come back as eczema. That's the diagnosis she gets, or the diagnosis she gets for these open sores of blisters and stuff that we're getting, and we're 0.3 miles away from the thing. We can't even canvass in this town to help these people as a community, and everybody wants to, bash people and the stuff that's going on, when, hey, if you're not sick, thank God you're not sick. But there are some people that are sick, even if it's a mental illness or whatever, stress-related, however people want to say it, they're stuck in their homes, and we can't even help canvass and work with you guys as a community because of the outlet.
And that's something that we can help with too. So if you know there are people that are stuck in their homes, there are physicians that go to homes, and there's an agency in this area that can do that. So if that person has a primary care physician, that primary care physician could try to get them on that list so that the doctor can come to the house.
I think the problem is even getting to that point. What we were seeing when we were canvassing is there are a lot of elderly in this town that are in their homes that have no access to smartphones, that don't know what's going on or where to find the resources. Perfect example today, I went and picked up a couple of women that were literally screaming out their front door, "Someone help me, I'm in my house and I'm sick." They're both on Social Security. They have Section 8 housing. They have no mode of transportation. And had I not walked by that door at that time and she didn't decide to yell at me, she would still be in her home. So I think the frustration that he's expressing is not from you. It's just from
I'm not
the
thinking of it as
canvassers
such.
not being allowed to go door to door. So I think if you guys have the resources and you're allowed to do that, there are people that are suffering that don't have a way to use their voice.
And it's critical, this time that it's been 4 months, and this is critical time. I go to an oncologist to find out if I have leukemia. My numbers were fine. My numbers were fine before February 3rd. So it's not gonna take months or years. I mean, this is happening now. And I'm trying to get.
And again, we've had eight
I'm
of these
just-
meetings. We've had 8, 9 of these meetings, Mark, right? Not one city member has come to one of these. But it is a problem to me because, they expect all this other things, or going to the park. It's a city, it's wrong that we're sitting here going through this and they're not hearing us as a people. They got their little cliques going on, and this is what we have to go through. That we get charged $400 to go help people. This is messed up, and this is why I want out. I've been trying. And there's no way, because I have a mortgage. We just bought a house 8 months ago. This is the whole reason. And this is the frustration, that why people are, we started a unity council. This is why, because there's so much backlash that we get from the community that's in the clique and thinks it's okay or is afraid to say something because of the backlash. So, we're getting fought to walk our own streets to say, hey, do you need help? If not, go to the next house. We're getting fought for that.
Can I ask a question? Who's preventing you from knocking on a door?
The mayor, the city has a city ordinance
It says what?
No door-to-door.
No-
No door-to-door what?
It
Communication?
was put, well, I don't know, maybe someone in the room has more information.
Have you
but,
heard about the First Amendment?
The ACLU was contacted, and when the mayor got the flyer from, I guess, it was called the Watchtower, he thought it was Jehovah's Witnesses. But we have contacted the ACLU. The canvassers were stopped by the East Palestine Police Department, told they had to pay a $400 fee, and they had to.
For going to talk to their neighbors?
Vendor fee.
What are you selling?
Nothing, not even
We're
asking for
selling-
donations.
What we're selling is trying to help people to find out.
Yeah, I think that I'm a lawyer.
That's what we're selling.
Nick and I are appointed by the federal court to be liaison with the community here, so we're trying to attend these events. And that dog don't hunt.
It is happening.
Thank you.
It is happening.
Okay, well, so there needs to be some other,
Right, I'll give you my contact after this. I mean, I'm not.
you
an
can't
attorney.
prevent somebody
Right.
from going to the door and talking with them. That's the First Amendment. That's just very clear.
And I agree with that.
And a city that is carrying on like that and preventing that is creating an additional liability to itself.
The woman that I met today who was yelling from across the street, we need help, we need out, with her 82-year-old mother, I could have possibly reached them, or someone could have, if we were allowed to be out canvassing.
You have an absolute right to talk to anybody you want. Okay, you're not selling stuff.
You want to go canvassing after this?
Well, I'm
Or
just.
at least give me your number.
And Palestine, the city, creates an exposure, a liability to itself by interfering with that. They just do.
And that's what I'm saying, like, they won't help the community members that are suffering, but they won't allow us to help them either. So I feel like our hands are tied, and again, I apologize that this frustration's coming out on you guys, and it has nothing to do.
Is there a legal services option in Columbiana County? Anybody know?
They have legal aid, but you have to have a, yeah, you have to have a.
Their offices are, yeah, they're on our county.
I was on their board years ago, but I have a question for the doctor, since I'm holding the mic. It was my impression that for at least a couple months after this, that the local medical community and the clinics and so forth did not have the expertise to deal with the situation. You seem to have suggested that at some point you were given some input from on high or some organization that gave you some standards to think about. But I think part of the frustration here is people go to the clinic and they've been exposed to many of them, to some pretty heavy-duty stuff, dioxin and vinyl chloride and maybe phosgene gas and God knows what else. And the medical community didn't have the background to help them think about this, and so you get diagnoses that are, you've got an inflammation and I'll give you an antibiotic and so forth. But it's more complicated than that, isn't it?
Yeah. Yes. So as a medical professional in this community, I certainly didn't know much about those things. I was the doctor that did about 90% of the work in the temporary clinic there. By that time, I got a crash course in that information, and I was fortunate enough that I had some toxicologists that were very kind to me and willing to take as much time as needed to answer all the questions that I had. And there were times I would talk to the toxicologist for an hour or more a day because I'd see one patient, call the toxicologist, see another one, call the toxicologist, because that's what we do anytime in medicine. So if I come across, I didn't know anything about COVID when it hit, but then you start to talk to people that are experiencing it, and we got information from those people in New York who dealt with it a month or two before we did. So it's no different than any other situation. You reach out to those that know or that are experts in that field, which is what we did. So the folks that came into our temporary clinic, they were, in essence, when needed, being given advice by a toxicologist via me or whichever doctor was there. So, but the problem was we were not in a capacity to be able to draw labs and do those things. And if a patient did come in with a rash that needed a certain treatment, we were not in a capacity to be able to do that. And that's really why we knew that we needed to open the permanent clinic. But that was only one aspect of it. If you look at every primary care office within Columbiana County and the surrounding areas where the residents from East Palestine may go, didn't have that necessarily. I was fortunate that I had that. We all have access to poison control number that any doctor anytime can call and get a toxicologist. And we use them frequently in the ERs with ingestions and things of that nature. So any doctor has that ability, but you've got a doctor that's got a full schedule with patients that they're seeing, and then this happens, it's hard to be able to fit that time into it.
That's why we need the CDC.
Well-
They were told not to diagnose anything with chemical or.
Yeah, I heard that, but I can tell you, as one of the doctors that was in the center of all this, I never was told by anybody not to diagnose it.
Yeah.
Okay,
Yeah, Mercy
all right.
Health is
So-
also the one that was told not to test for vinyl chloride anymore.
That would be, if that's what happened, then that would be a decision within an organization.
Right.
As opposed to the CDC. And just to be clear, and the lawyers can correct me on this, there are regulations of what can and cannot be said to a medical professional. I work for somebody, but that doesn't mean they can necessarily tell me how I have to treat a patient, if I might be correct on that. So you can have some guidelines and you can have some suggestions. So that may be the case with Mercy. I don't know. I didn't hear that. I don't work for them,
I saw
but.
the memo you're talking about. What it was, if I'm talking about the same memo, it was actually put out by some organizations, some high ups. Poison control was one of them. Are you talking about that memo?
Yeah, but
Well,
there's
it was
also, I got the
2 pages, and what
report.
it
This is the
was,
first one.
it was,
I read it. So it was clinical guidelines to guide local providers and clinics as to what was appropriate or not. And what you're talking about, I think, was in those guidelines, it was talking about it's not appropriate to test for the thiodicalcolic acid as a metabolite of the vinyl chloride because at this point, we're not seeing it on the air monitoring. And I was really upset when I read it too. But it was clinical guidelines, so no doctors are forced to
Yeah,
ever
it was just
follow
something
those
else.
guidelines. It's like the CDC saying, okay, this is what we think you should do with this. And the doctor's like, oh, well, I disagree. You know what I
Well,
mean?
I went
They're
into
trained
Mercy Health
clinicians.
and-
I know the lab's doing it. I'm appalled at Mercy Health, and I'll go right on record saying they should be ashamed of
Well, I got them
themselves.
on record on
I saw it.
video saying that the CDC set these guidelines. So then when the CDC came in here the last time Mark and them brung them in, they said, oh, we never did that.
But I'm somewhat critical sometimes of the medical agencies and the mental health agencies just because of where I'm coming from. But I will say that her clinic right there, they are doing the chemical diagnosis. I can share that because my children and I have all had that exposure diagnosis. So I'm happy to see that. That's been in the last month that diagnosis started to show up. So I went there expecting like to have to fight for them to listen to me, and I've never had to do that. In the beginning, they didn't really know what to tell us, but since then, I've not seen anything. So I don't know if that helps clear up that document, but I
Right,
believe
'cause
that's
it
what it
didn't-
was.
yeah, I don't
It
think
was
that
clinical
was-
guidelines, and I still disagreed with the guidelines, but it helped me to figure out, okay, this is this agency that I really disagree with anyway, telling people what should or shouldn't happen, or what is or isn't appropriate, but every physician can decide that for themselves. So I don't know if that helps or
No,
not.
it does. I appreciate you saying that because I quit going to the doctors because 3 times I've been on antibiotics and steroids and told I have an upper respiratory infection.
Right, and I,
6 years old, I've had them before. I've never had one that I went through 3 rounds and still have it.
yeah,
And
I've
I've
gotten
had
bad
3
care
months.
through this,
I've
but I
had
have to
3
say that they're doing a really great job up there now, and I can't
Okay,
find anything
I
bad to
just wanna
say.
visit with you.
Okay.
And I'll be bringing some other people to you too.
Okay, that's.
Come Friday, I'm there.
Sorry, I didn't mean to answer that. I just thought maybe that might
No,
help
that's
to know where
helpful.
that
I
memo is
trust what
coming
you're
from.
saying, you know,
Yeah,
someone
I
that
still
you
think they
know.
were wrong for writing it, don't get me wrong. I
no.
still hate those guidelines, but it's helpful to know that each individual person, now, it takes a doctor or a clinic of excellent moral character to fight against it, right?
Right.
Because there's all this peer pressure to do what the
Right.
agencies want, but they're free to do it,
You know, it's
so.
not even a diagnosis of chemical exposure. It's, what do we do now that you're sick? Who cares if it's chemical? We know it's chemicals, but treatment, like,
Well, the CDC said they can't treat for vinyl chloride, they can't treat for benzene, but they can treat for the cancer that is caused from these. That's what exactly came out of their mouth. So that ought to tell you something.
Question I got, Doctor, I was glad to hear you say about poison control, because Dr. Ann was one of the ones that came in with the CDC, and he said that there is a medical toxicology clinic, not in Ohio, but one up at UPMC in
Pittsburgh.
Pittsburgh, but you need a physician referral.
It's
And-
very
and-
similar to any other specialist you would need to send a patient to.
And he said Dr. Abasamis runs it, but if they come to the clinic
Yeah.
and they need further testing, can they then get a referral up to?
100%.
Okay.
Yep.
All right.
Or if somebody comes
Yeah.
in, there's,
Thank you.
and you would need that too, if one of your complaints is that you've had 3 respiratory infections. At that point, you need to have respiratory testing done, and you need to see a lung specialist.
But that clinic's excellent up there, right, for testing for these type of
Yes.
incidents?
Yes, and
To get in with this many people, that's the only
it really won't. We're pretty well stocked. Yeah, yeah.
Okay.
And then if we don't have that specific service there, then we can refer and make sure, but we don't just give a number and say, here, best of luck. We're going to make that appointment for you and make sure that it's set up.
I actually went to Mercy Health last week, and this is the first time since enrollment. I also had 3 sinus infections, Med-Despac, and I have fluid in my ear from inflammation, and she said possibly because of chemical exposure. That's the first time I've heard that in all this time.
Well, from the moment we opened our clinic, that has been our diagnosis because that's what shows, that's actually how we define the patients that were exposed. So
So the
we know.
inflammation seems to be a big thing that's causing a lot of problems.
Well, anytime you're exposed to something, you can have inflammation from it.
Gosh, am I dreaming? There's a doctor that's not gonna fight us. No, I'm like, someone pinch me, like, people are just so tired of being fought by their own physicians.
We're all gonna send people to you.
Right, and sometimes physicians that have been our physicians since we've been 3 or 4 years old. So to hear that you're not fighting and you're actually acknowledging
Yeah.
that we've been exposed, thank
Yeah,
you.
a lot of it is time to go through those tests, and in particular, some people that have vinyl chloride testing that's been done. I've learned a lot about vinyl chloride in the urine over the past few months, and so a lot of it is just being able to sit down and discuss the other ways that can come from and the values that matter, and getting that toxicologist on the phone, or getting you to the toxicologist. Because if there's any way that this is something less concerning, you want to know that so that it does decrease some of your mental health issues. Yes?
Are you testing for dioxin?
There actually is no lab that I can find in this country that I can send samples to be tested for dioxin. They do test for them in certain labs, but it seems to be with research or in larger industries. But as a physician, I can't just send a sample and ask it to be checked for dioxin. If there is one, I'm not familiar with it.
Research us. I mean, we know we've already been exposed and, like Linda Murphy said, if we're gonna be lab rats, do it right. We don't want anybody else to go through what we're already suffering through.
So, that's all we want, is we want it done right to help someone else. If there's no help for us, then just be honest, I'd rather have honesty and the truth than the not knowing, not having answers. That's what the mental part of it is just
Well,
living
certainly.
in limbo constantly.
I think I shouldn't speak for everybody, but I think I can speak for everybody here that we completely empathize with what you're saying.
Right.
It's a very terrible situation you went through. I'm a resident of Columbiana County. I'm in Lisbon, so, I'm further away from that kind of concern, but it's still very concerning.
Right.
I have a farm, I have animals, what about them? I think it goes through everybody's mind, and when you're all right here, I empathize with what that must feel like.
Other questions?
Do you have a question, Edwin? You want to ask him about Hexel?
Yeah, Robin?
So I don't know if this is the right forum, so I want to see if you guys are kind of putting your heads together to think about an issue that I think we've all kind of expressed, is that, listen, help is not coming from city council or from this mayor, and I don't care if I'm quoted saying that. They are not going to do the right thing. So there's a sharp divide, and at this point I say, let them do their thing, but what would you say to us residents that have to try to come together, that the residents are so divided, like sharply divided, like say the wrong thing and somebody's going to rip your head off on either side. So are you thinking of ways that you can try to get the message to this community that, hey, your neighbor's sick just because you're not, or hey, you're sick, but just because they're not, to kind of bring this community together, because it is very fractured, and that's going to make everything worse. I mean, I know that's a tough question to throw out there, but, I mean, you try to get the leaders that are going to help, but when they're not, you still have to move on. And it's very hard to do in such a divided climate. I mean, I don't know if there's a response to that, or if you guys are thinking of any kind of community outreach for fractured communities like this.
Guessing, Ron, but
It's a
that's-
thinking
yeah,
question,
no, it
I
is.
guess,
It
right?
is.
It's
I'm
a thinking
thinking-
point. But I think it's worth thinking about, because it's
Yeah, it-
really stressful. Sometimes you're afraid to ask questions because this person or that person is there from both sides. I am not taking one side or the other, It's
But you're
just-
asking about social science, and so.
I know.
Yeah, that's something we can explore.
I think, yeah, definitely it's something to think about and to plan for. Robin, I know one thing that, I went to the council and approached them about a option for a coalition building group to come in and kind of help to bring all the different entities together. And because of some of the situation right now with the council in terms of not having a permanent village manager. I think that, they're hesitant to start that process right at this point in time. But there are definitely some things, and I can tell you that one thing I can say is that the local people really work well together. I think one of the things that, you have that's going on right now is there is a lot of people involved, federal, state, local, and at least on the local end, I mean, all of us communicate. We are in meetings together all the time, so if we can do some things on the local level, we will definitely try to come up with those things, and we'll support anything we can. We can't control, what happens at some other levels, but we'll certainly, be there, and you're free to call any of us.
I have a question. I'm going to change the subject. When the last flyer that came out, it said that the American Legion's water was tested and it gave this blah, blah, blah answer. Can anybody clarify that?
Sure can. Jamie, you want to clarify?
Yeah, we researched that as Unity Council. I actually yelled at my brother and says, don't post that until we research it, because, right, it was an ad. The people were trying to sell water filtration systems. It wasn't a battle that I was willing to fight right now with all the other battles. People putting out that false information. So I'll speak for Mark Durno when he says verify. Right, Mark? Verify it. Don't just take that stuff for granted.
They spike the water samples with vinyl chloride to see if their filters will take out vinyl chloride.
Exactly,
So.
yeah. Right.
So what we did is we asked Ohio EPA as well to research it, and they contacted the company, and I guess based on multiple fronts, the company took that ad down. They spiked the samples in their lab.
Just to see if their system would get it out.
Yeah.
So it wasn't saying there was vinyl chloride, it was saying if there is, their system will get it out.
It was just the way it was worded.
Right,
It didn't make any
exactly.
sense.
Oh, no, yeah, we all freaked out when we saw it. Trust me, we all freaked out when we saw it.
Do you test for dioxin in the water testing?
No, that's not one of the, no.
But when you burn vinyl chloride, you get dioxin.
Yeah,
But you don't test for dioxin,
We
and
would-
it's got a half-life of about 80 years.
yeah, so, like we talked about the last time you and I discussed dioxin issues, we look at the priority contaminants, the ones that would be most likely to get into the ground at a higher rate, and we look at those priority contaminants first. If the priority contaminants start to spike, then we'll start.
Where did you get the list of priority contaminants?
Look at our potable water sampling plan on our website, on US EPA's website, and there's a list of 29 priority contaminants.
In what circumstance?
What do you mean?
Well, if you burn vinyl chloride, you get different types of dioxins.
Right.
So you can't have a one recipe fits all chemical spills because there's an unlimited number of chemicals.
That's right. There is an unlimited number of chemicals, and that's why we've narrowed it down to the priority contaminants that we would expect to be either present or generated.
From what type of spill?
the spills that occurred at the derailment site. Now, again, I've got our environmental unit, we got a series of experts that have gone through, reviewed all the science behind it, and this is the list that they came up with, so.
I think you're confused. If you haven't been at the other meetings, your barbecue.
I was at a few, I was on
Your
vacation.
barbecue grill will put dioxins into the air, but that big barbecue over our town, it didn't do it.
Oh, it
I
did.
just want to make sure you knew that.
It did, Jamie. We all know that it did.
Right, we
but-
know that it did.
yeah, But again, it's about the levels and concentration, and again, from the samples that we've collected in soil, and we've talked about this before, we're not seeing a heavy dioxin burden from the spill. We didn't see a whole lot of phosgene or hydrogen chloride, even though we saw it in the environment.
How do you know there's no dioxin if you're not testing?
I didn't say that.
Oh.
We were testing for it. We
Oh.
have seen it. All right, actually, let's look at it from let's look at it from a different perspective. In the waste, right? That's where you're going to have your highest concentration of that particular chemical. And we've seen that particular chemical between 700 and 900 parts per trillion, okay? That's even below our highest residential, the 1 part per billion. So there are probably 100 chemicals that were created. We're focused on the chemicals that have the highest probability of transport and the highest probability of impact. So, yeah.
How many hours a day is that bus running for the air quality testing?
The analytical bus, the PTRMS and the TAGA, those run as long as work is active, they run. Now, at night, they do not run.
So are they testing for like industrial levels, like the time you would be exposed, like say, for example, if you worked at a vinyl chloride plant, as opposed to, people that are getting exposed 24/7?
Yeah, those, I can't think right now, action levels are set below the 20 part per billion lowest exposure level based on the risk assessment that was done by ATSDR. So we can see it at those levels or less. So 20 parts per billion is that limit.
Based upon a risk assessment that was done by whom?
ATSDR, the Agency for Toxic Substances and Disease Registry.
EPA is not the one in risk assessment. Right?
Well, you're thinking about something different. So it's actually a health consultation, so I used the wrong language. It's a health
So
consultation.
are they accounting for all those different chemicals? That's what I keep asking, because.
Yeah, and that's.
Below reportable levels.
Exactly, and
35
right.
different chemicals.
Yep, yeah, we've talked about that before, and that's where the research piece of this comes in. That's the reason that we brought NIH into the mix, and there's going to be some
So
research.
we won't be looked at until later.
Yeah.
They look at it as an 8-hour, is it looking at as a residential, or is it looking at?
That's what I just asked.
Yeah.
Okay, he said it's at a residential.
Yeah, the levels in air that we're measuring for
Because I got my
are
sample-
at residential.
sample back from my house from JSL, and one whole page is, I had a toxicologist look at it, the benzo, the RDL, which don't mean too much, is .03. The chemicals that are on just one of 72 pages is nothing but carcinogens, and they're 10 times higher than the RDL.
Okay, we'll take a look at it.
Yeah, like I said.
We'll take a look at it.
Yeah, so I would like to see about, what's going on in my
Yeah.
home with the benzos, the fluorotine. There's so much in our home right now, and I don't know if that's what she's getting.
Okay. Quick site update. You probably saw this, did the newsletter arrive today? Did you guys get the newsletter today?
It'll be in the mail tomorrow.
It'll be in the mail tomorrow.
Copies here.
I don't
Okay.
live in town anymore,
Oh, that's
so
right,
what
yeah.
do we do?
Okay, well, so there's, yeah.
That's the sign-up sheet.
I can email it to you, Jamie.
Yeah.
My email is so crazy right now, I'm not gonna lie.
And we do post it on the website as well.
Okay.
Yeah.
Post on the website
Thank
every Wednesday.
Yeah. So long story short, so the last bit of contamination under the tracks was excavated yesterday. That was just west of North Pleasant Street. That's been confirmed clean. We excavate to groundwater standards. It's been confirmed clean. It's been backfilled. That track was being reestablished today. I'm not sure if it's finished yet. By the end of this week, we anticipate that both tracks will be active. So that's the track.
They had both tracks active yesterday.
Yeah, they were. You're right.
Okay.
But It would have been 2 days ago, actually.
Okay.
Yeah, it would have been 2 days ago, yeah. But yesterday is when they started the dig. and then-
Okay.
But hold that thought. So let me finish and then you can ask.
I'm sorry.
Yeah, no, it's good. It's all good. So on the north of the tracks, where all the burned out tank cars were staged, that's the next step. So starting tomorrow, they're going to start scraping that material. Probably take about a foot of soil. Stage it, get it prepped for removal, and then we'll visually inspect it. If it looks clean, then they'll start the sampling process. If the samples come back clean, it'll get backfilled. If not, it'll get another foot will come off. So that's what's happening north of the tracks. We don't anticipate that to last too long because we know there weren't any active spills over there. It's just where those contaminated tankers were staged. After that's done, then we move south of the tracks, near the Ceram Fab facility. We know that there's some pockets of heavy contamination in there. So, what's that?
Is Ceram Fab coming down like
I hope not, but we'll see. I mean, that's part of the investigation.
We all heard it started.
How do they get under it?
No, what you guys have been seeing is sheet piling that's being driven to protect the railroad tracks and also protect the foundation of that structure.
Okay.
So it's not coming down. Actually, those are protective sheet pilings that's being put in to make sure that the building isn't damaged from the excavation work that's going to happen. Yeah. So the next step is figure out where the contamination is migrated. If it has migrated to or under that particular facility, then decisions will have to be made based on that. But we'll see.
And then will you look at State Line Lake?
So State Line Lake was never impacted. And so we've been sampling the water coming off of State Line Lake, and we haven't seen anything in it to date.
Mark, when is
So.
the full site assessment? Because they've not done a full site
You're
assessment.
exactly
So,
right.
I mean, where they're
Yeah.
contaminated
So
on
that-
the railroad tracks, but we don't
yeah.
know how far it goes or where
Yep.
it's at. and-
No, great question, Robin. And that plan still has not been approved. We've been talking about it for a month, and we still have not approved that plan because it hasn't met our requirements.
Is that normal, Mark, in these situations, or shouldn't they assess the site before they're 4.5 months into cleaning up the main contamination?
No, not necessarily, because we started this under an emergency umbrella, okay? And so it was get in, write we call it the mainline track removal plan. Write the mainline track removal plan that did include bottom sampling, to groundwater standards. So there has been an excessive assessment just underneath the tracks in the center line.
No, I know
But-
about the work
Yep.
plans and the assessments,
Yep.
but it seems to me you would do an overall site estimate.
So
to see.
we've had that plan in the works for a long time. And again, until we agree on how thorough that assessment plan is going to be, which may include more dioxins. EPA and our partners, all the
Norfolk Southern and.
so Norfolk Southern's writing the plan. We will not.
Why aren't you guys just telling them?
Well,
That's
we
what I
did,
don't understand.
so that we directed them to to develop the plan.
But
All
then
right.
it's negotiated?
And then they develop the plan, we send it back with comments, and we've been going back and forth. Now, we also have our partner agencies look at it. Ohio EPA looks at it.
But-
Other partner agencies that have investments, ODNR for the surface
I
water piece of
understand,
it.
but my concern is the passage of time, because this is a rough draft. Nope, kid, you have to do more detail here, here, and here to assess the site, but we're living here during that time. So it seems to me like if we're gonna make a plan to clean up a spill, we better know how far the spill is before we start.
Or when can people get back in their homes?
Yeah.
Like, that's the.
Yep, your frustration, I share it. Because
I mean, I think it's really hard to.
I've wanted this plan to be done.
Is there a time of a limit legally that they have to make I mean, we're just talking about, so they could do this assessment and there could actually be contamination found further up the railroad tracks, right? Possible?
It is going to be assessed, yes.
So it's
Is it
possible.
anything's possible.
Right, because they never sampled out to find where the margins of the contamination was. So, I
Anything
mean,
is
We're stewing in a chemical soup.
well, maybe not, maybe, I don't know. My point is, it seems like at 4.5 months, like, when are we gonna establish the boundaries of where this pollution, at least on the ground
Right.
or in the water, the air's harder to call, but
I 100% agree with you.
is there a limit legally? Like, do they have a certain amount of time?
In our administrative order, we gave them a deadline to submit the initial plan. That's the only deadline that's actually.
Oh, so they can go back and forth for,
It won't, if we do get to a point that there just is an impasse, then we will order the work directly. So
Will you do the site assessment before, if it comes to that point, to see what you
We'll
need
see.
to order the work?
Yeah, we'll
or-
see, we'll see.
Okay.
I'm not
Well, I
gonna,
just wanted to get that out there, because I
Yeah.
know that's a
Yeah.
really hard, frustrating part, is how do you clean up a mess when you don't know
Yep.
where to stop cleaning, you know, because,
no, I get it, I share your frustration.
Thank you.
100%.
Don't even know
Thank
what
you.
to clean our houses with, let alone.
maybe they'll tell you that when you're done assessing. Sorry, I
Yeah.
try to not be sarcastic.
And the rivers, river assessment as well, same thing.
Well, the creeks will settle for first, 'cause
That's what I meant. That's what I meant.
I'm gonna
Yeah.
ask this question, I was here because I went down to EPA office early. I was down at Sulphur Run, when they were doing their, sediment cleaning, I guess, where they're starting. They're only focusing on the bottom, like where the water's at. Why aren't they focusing on the side where the most contamination is at?
Yeah, that's part of the assessment plan as well, to assess the sidewalls and the river bottom. We don't want to start undercutting the creeks, okay?
Yeah.
So that's a big part of it. That's the best answer I could give you right now
Okay.
until the assessment work is done and we
Okay.
come up with a remedial
Okay,
plan.
so it's still ongoing, still
Yeah, oh, yeah.
assessment.
Oh, yeah,
Okay,
yeah, yeah.
okay. All right, thank you.
Yep, Jamie?
Something important to tell you. So I was rewatching the videos from the,
CTEH toxicologist that came into my home when, I was initially told that they would move me and get me out of there. And at the time, the word didn't mean anything to me. But rewatching that on my way to Columbus, I noticed a couple things. First of all, I was asking which chemicals were in the creek. And, we said we haven't even seen a manifest yet. I guess I didn't realize that.
Yeah, so this is,
That-
you're talking early in February?
Yeah, I'm talking, this was February 14th.
Okay.
We didn't know what was in the creeks. When I asked about water testing, they told me that it had been done, but the results had not been released yet. When I asked them about soil sampling, they told me that they were not doing soil sampling because the EPA didn't feel like dioxins were a possibility. And then the only thing we had was the air testing, which we all know wasn't really air testing. So when we were told it was safe to come home by, I'm assuming the EPA had something to do with that.
We were part of the process.
Yeah, I mean, I usually trust my government, but I'm telling you, when I saw my creek, I didn't. But, none of this testing had been done, yet they were telling us it was okay to go home. And the words that I picked out was something that you always use, this pathway to exposure. What this guy from CTH, he was a lead toxicologist, I have his name in my phone somewhere, what he said when he saw the water running down my basement wall, which is exactly what this gentleman is talking about. There's those embankments on both sides. So all those chemicals are leaching into the side of those hillsides, and that water is leaking into my basement. It's not overflowing, it's just going through. And he said this is a possible pathway to exposure. So he used that term as early on as February 14th.
Yep.
So has there been testing done in people's basements that have this stormwater leaking into
Yep.
their basements?
The answer is no, but there is a possibility because, again, that's part of the assessment, the overall river assessment, right?
But you're right,
So-
but when he used that word,
Yeah.
pathway to exposure, I'm like, this is February 14th. If they knew that this is a potential pathway to exposure, when you can ask most reloaders in town, our storm drains are so bad, they have to do a dye test before they sell homes because these storm drains, leak into homes and basements. So on February 14th, when CTH is telling me this is a possible pathway to exposure, why wouldn't they at least check all the homes along the creek?
It's a good question.
And then my other question would be, this runoff. We all saw the rainbow water running down our streets after the first rain. So even if that stormwater is not leaking into your house, what about people that all that rainwater ran off of their houses into their yards? So when we're talking about this pathway to exposure, I guess, my biggest question is why weren't they looking at it when they themselves, CTH, used that word? And if we're all searching for this pathway to exposure, why wouldn't they have done that? And my second question is, I know you keep talking about, finding this pathway. Do you think it's there?
So,
Yeah, it has to be.
So,
I'm asking,
so,
right, I
but,
know
no, but
my
you're,
opinion, but
yeah,
I'm
but
asking.
you're, in, it depends on which contaminants we're talking about, right? So the volatile organics are going to, they're going to off-gas quickly, right? And we know that. And that's been one of the, areas of, I don't want to say disagreement, but, we've been doing extensive outdoor ambient air sampling, right? And we're not seeing the contaminants of concern in the outdoor air. And we would not expect the indoor air to be contaminated either, because with those, well, hear me out, Jamie.
Right,
Hear me out. With those particular contaminants, because they're volatile, they would have been long since gone by now. Now, for those who may have had, water or sediment infiltration from the creeks, I think there's some validity to investigating those. And we've been talking with our team about that, because we know that here in another month or two, we're going to be getting to the point of whether or not it's appropriate for those that aren't in their homes to come back. So we're actually talking about those things right now. But the, again, the volatile organics, we wouldn't expect to see them.
But because what he was saying, and maybe you can answer this, was if that water were to puddle in my basement, it would release vapors. And that's when I asked him, well, who's doing the air testing in my house continually? So when you're talking about not expecting to see different levels in houses than you do outside,
Yeah.
if these chemicals are in their basement, there could be different levels. And it could be explaining why some people are sick and some people are not.
If they are, right,
Um,
right. I'm not going to argue that point.
So, when we asked the mayor for a map of the storm drains, we were told that the only one that exists is an old one that Gary Clark, everybody knows who he is, drew with a crayon that's down on the wall in City Hall, and he was apparently too embarrassed to take a picture of it and send it to us. So even, knowing where those storm drains are, knowing which ones are really bad, leaking into basements, leaking into yards.
Yeah.
I mean, I know you said,
Oh, I saw one this week.
right, and you
Yeah.
said, we don't really need to test the storm drains because all that water goes into Sulphur Run, and we're testing Sulphur Run.
Well, and I was talking about the air quality in those storm drains, not necessarily the
Okay.
sediments.
Gotcha.
Yeah, I was talking about air quality specifically.
With them walking through the creek at the entrance to the park, I don't know what they're doing down there. There was vac trucks and stuff. I took a video of the chemicals coming still up out of the creek right there, while kids are walking past and swimming at the swimming pool. You say that they go up into the air, they dissipate. Is there a health risk for the kids walking right beside that creek while they're walking through it and pumping and doing whatever they're doing down
Are
there?
they actually going into the creek?
Oh,
I
they've
have a picture on my way here, they were in the creek pumping something.
Yeah.
So I didn't know if, since, the chemicals are coming up, they're obviously going into the air. We got kids walking to and from the park. They're all up there swimming while they're doing all the work at the entrance of the park. What do you feel about that?
Well, we sampled during, we air sampled during the heavy sediment washing and air knifing that was going on down there, and we never saw any levels away from the water that were levels of concern in the air. And we wouldn't expect to see that now, this much time in the air. Now, they shouldn't be in the creek because, there's potential for exposure there. So, if that's happening, then we'll make sure the city's aware.
Because you haven't assessed the creeks yet, right?
No, we haven't assessed it. We do have data from
But it hasn't
the
been
early days.
overall. I'm not being smart, I'm just asking, they haven't been assessed.
No, that plan has not yet been approved. That's right.
You're our fact checker for when we hear stuff, we need to call you to check the facts.
Mhm.
So I'll make sure everybody has your number before we go.
Oh, you have my number, so.
No, because you are helpful. There's times, when I hear stuff and I don't know what to believe, so sometimes it's nice to call and say, hey, Mark, why are these people on the creek?
Yep.
Because 20 different people have 20 different opinions
Right.
of, they're down there.
Well, they've been there
planting
for the last
fish,
34 days. I
Yeah.
think,
Yeah.
I was down there 5 hours today. I spent 5 hours down there today while they were cleaning.
Yeah.
So,
And I know they
You're
were there
persistent.
all day yesterday.
yeah, they were there yesterday too, yeah.
So,
And
okay.
yesterday they were in full gear, like full
Oh, with
on
yeah.
PPE, like,
I was swimming up there, so.
Right, so it's okay to be at the pool.
Again, even when the contamination was a lot heavier, we weren't seeing anything in air.
Okay.
So, yeah.
I got hit in the face with one of those aerators. I was standing next to it. I didn't realize that it was turned on, and they turned it on, and I'm telling you, it smacked me in the face like an invisible wall of smoke, and I didn't
Yeah.
have a voice for a week.
Oh,
So,
jeez. Okay. Well, we've, I think, used all our time and then some, so Phil, any, oh, it's all good, Jamie, thank you. Any
Yeah, I was
closing
just going to
comments?
say thank you all for coming. I hope this was helpful, and yeah, feel free, to come up to us afterwards. We'll hang out for a bit, and we're planning to do another info session in July and do a broader operations update. We don't have a date yet, but that's the plan. And then if there's anything, if you want us to do another sort of health session or anything else that y'all think would be helpful to do in July, let us know, and we can get that planned as well.
Can you
So.
just get us all their contacts in the flyer next time?
Oh, in our newsletter? That's a good idea.
Yeah.
And if you guys want to,
That's a good idea.
your contacts, we're doing a newsletter for Unity Council. And we also are starting a page of links to like all the different health studies. If you guys have links, it's kind of a resource page we're trying to create. So, thank you.
Yeah.
Thank you guys so much for being here.
Yep.
My fellow Columbiana County.
Thanks, everyone.
Yeah, thanks.